Well, as we approach the middle of August, doctors continue to warn about UV safety, and we're speaking with Dr. Aaron Jones about how you can protect yourself and kids against skin cancer risks.
There are multiple sources that you can receive UV radiation from. The ultraviolet light is what UV stands for, and while the vast majority does come from exposure to sun, tanning beds are a major source of UV radiation. And there's some pretty popular now, some UV cleaning tools and some bulbs that some people sell and can use to help sterilize some products, but the vast majority is from sunlight exposure. UV radiation from the sun can cause skin cancer, and that's our biggest concern from a healthcare standpoint. So that's what we're trying to avoid when we're asking patients and the public to be aware and know a little bit more about UV radiation. There are other health concerns from UV radiation exposure from sunlight. Some less commonly known ones are a decrease in your immune system. For instance, it's common to have a flare of a cold sore from long-term sun exposure. Also, cataracts and other eye conditions can be worsened and more serious after long-term sun exposure from UV light. American Cancer Society states that skin cancer is the most common form of cancer in the United States. Approximately 1 out of 4 people in their lifetime will have a skin cancer. It's also a preventable cancer. So that's why being aware of the risk and knowing how to prevent sun exposure and radiation exposure from the sun can be helpful. The sun does have some benefits. It can help with mood, and also vitamin D is metabolized in our body through sun exposure. There's now recommendations from the Mayo Clinic and other health authorities that recommend taking an over-the-counter supplement for vitamin D because oftentimes the sun exposure we receive is during the hottest times of the day, the most intense parts of the day. So I recommend if you are going to be outside and you want to enjoy the outside, staying outside in the early morning hours and in the evening, trying to avoid in particular times between 10 a.m. and 4 p.m. is helpful at still getting some sun exposure, but not having as many risks. Annual physical with your physicians is always a good place to start to go over any concerns you might have about spots that you've noticed from sun exposure. Doing a monthly check and keeping a close eye on any new moles, freckles, any new spots. I do think a lot of patients will present complaining of some sores that won't heal, and I'm able to find and treat those properly as precancerous cells or even early skin cancer. It's common for patients to have concerns of their skin. They'll call and ask for a referral to dermatology. And I try to recommend coming to see your primary care doctor first. There's a number of skin treatment options and a number of skin lesions that are completely benign and nothing to be concerned about. So those can be handled in our office, no problem. If there's more serious problems or if further treatment's needed, we're always happy to refer on to a specialist or dermatologist. I'd encourage parents and caretakers of young children to be really aware of UV radiation exposure for children using a SPF broad spectrum, reapplying it at least every hour and a half to 2 hours and sooner if you're in the water. But 80% of lifetime sun exposure usually occurs before the age of 18. So it's important to make sure the younger children in particular are being protected with their skin.